Thank you, Fiona. And I'm delighted to be here today, although I have got the rotten slot, where your minds are full and your tummies are empty. So I'm not going to help that by talking to you about food for the next 20 minutes. So apologies for that up front. But today I'm going to talk about a broader approach to food and how it can help make progress on a number of public health issues. And I'm going to do that with a specific example of some of the work that I've been involved with in Glasgow. I'll be talking about an approach to food that goes beyond the possibly more traditional public health focus on diet-related ill health, on obesity and on food poverty, to think about the opportunities that public health reform offers us for thinking across the whole food system, and to think of the wider challenges for public health that exist across that food system, and to think about them in a more connected way. To go large, if you will, but without the fries. So what do we mean by a food system? In other words, how can we move towards a food system that supports our public health vision, that supports our move towards a Scotland where everyone thrives, and what opportunities exist across that food system to improve health and to reduce health inequalities? Before I go any further, I should just be clear what I mean about food system. So a food system is every part of the process of getting food to us, the cycle of growing, producing food, processing that food, distributing it, retailing it, consuming it and disposing of it. These food systems are enormously complex, they're interconnected, and they're increasingly global. And the food system influences many aspects of our health and well-being, the inequalities that exist in our society, many aspects of our economy, and increasingly our environment. We know that food and public health have a long relationship. I don't need to go into all the public health issues that relate to food in detail, because you know that stuff. But I'm just going to very briefly run through some of the kind of key stats. So we know that dietary ill health and obesity are big issues in terms of population health. We know that nearly 2/3 of adults in Scotland are either overweight or suffer from obesity. And we know that that's a risk for a number of illnesses, including diabetes type 2 and a number of cancers. We also know there's considerable social patterning in that diet-related ill health and obesity. In particular, for example, we know that women in our most deprived areas are most likely to be living with obesity, and those in the least deprived areas are most likely to be have a lower weight. We also see the same social patterning in children, again with children in our most deprived areas more likely to be living with obesity, and those in the least, again, have a lower weight. And that social gap is growing over time. In these same areas that have higher levels of diet-related ill health and obesity issues, we're also seeing unprecedented levels of food insecurity. Last year alone, 1.6 million packets of emergency food aid were delivered through food banks in Scotland. And that's only part of the issue, because we know that many people that experience food insecurity, and the formal definitions on the screen there, many people that experience food insecurity will not go to emergency food aid for their food. They'll somehow struggle by their missed meals. And there is that chronic challenge of households who are on a low income in knowing where their food is going to come from for the rest of the week. We know from Glasgow, the Greater Glasgow and Clyde's Health and Wellbeing Survey, that last year in Glasgow City, 11% of respondents reported that they'd experienced some form of food insecurity in the last year. So it's a big issue. We know that food insecurity results from poverty. We know it's because people don't have enough money to buy food for themselves and their family. But we also know that food insecurity is exacerbated by limited access to healthy, nutritious, affordable food in our most deprived communities. And we also know that there is an issue in terms of the affordability of healthy food. And I think this graph here from the Food Foundation in their Broken Plate report last year shows this in quite helpful detail. So for those that can't read the detail of the graph, along the bottom are income deciles, and this shows that for those households in the lowest income decile, which is to the left-hand side of the screen there, they would need to spend nearly 3/4 of their weekly disposable income after housing costs to meet our dietary guidelines. That compares with, on the right-hand side of the screen there, 6% of their weekly disposable income in the top income decile. This makes it almost impossible for people in a low income to eat well. But there are other public health issues across the food system, and I'm just very quickly going to touch on these. Our community food projects do really tremendous work across Scotland and across Glasgow in bringing people together to grow, cook and eat food together, and using food as a really positive means of working to improve health and get people together into communities. And they don't just address issues around diet and food insecurity, but they also use food as a positive lens to address things like loneliness and social isolation, mental well-being and addictions. And I think possibly we don't recognise and value the work that they do enough. And certainly many of them are in funding crisis just now, and that is a real challenge for our community level work on food. The food sector is a big employer in the UK, yet much of that employment is low paid and precarious. Again, this data from the Food Foundation shows that across the UK, if you work in the food industry, you're much more likely to be low paid and much more likely to be on the minimum wage than employees working in other sectors. We also rely increasingly on global complex supply chains, and with disruption that will come from climate change and unexpected extreme weather events and political instability, and I'm not going to mention the B word, but we know that when our food supply becomes disrupted and food becomes more scarce and prices rise, it will be those same vulnerable people living on low incomes that suffer the most. This relates to the other issue of the dominance of global food businesses. This slide is taken from a PHINS presentation a couple of years ago, and I'm not going to spend a lot of time on this because it was discussed at that PHINS presentation. But here, this just shows that there are 10 global big food businesses that control all of these brands. There are a huge number of brands that are controlled by very small, powerful forces, and these forces exert a huge amount of control on our food system and also wield quite a lot of political power as well, which means that we have more limited control of the food that we're able to buy. There are also massive environmental impacts of the food system, and in particular of intensive food production, and in particular of meat production and livestock, meat and dairy. But not exclusively, but insignificantly more. We've touched on this previously with Finton's presentation, but the environmental impacts of intensive food production, they go beyond greenhouse gas emissions, although that's very important, but it includes soil erosion, soil degradation, water scarcity, water pollution, air pollution, as we've heard, through overuse of fertilisers, and deforestation. And loss of biodiversity, including our pollinators. And together, all of these things threaten our future food production and will challenge us in the future, particularly as we move towards trying to feed 9 or 10 billion people by 2050 globally. And then we've got food waste, which is a big part of our food system. And a third of all the food we produce globally is never eaten. And the majority of that ends up going into some kind of landfill and degrading into greenhouse gases, carbon dioxide, methane. And an interesting, if useless stat, is that if food waste was a country, it would have the third biggest greenhouse gas emissions after China and America. And speaking of greenhouse gases, we know that climate change is a massive public health issue on the horizon for us. The food system contributes about 30% of our global greenhouse gas emissions if you consider the food system as a whole. That's about the same as the transport sector, but I don't hear the same discussion in public health or elsewhere about changing our food system to the same levels as we talk about trying to change our transport system. So these are a whole range of public health issues that relate to the food system. We have a plethora of policies and strategies, priorities and guidance documents about how we address these. And I'm not going to suggest for a minute that they aren't important. We need a healthy weight strategy and we need a target to reduce our food waste. But these are just a sample of the policies and strategies, either recently or current, that we have in Scotland that relate to bits of the food sector. It's not exhaustive, but it just shows that it's a very messy, noisy policy context. And sometimes when it is so messy and noisy, it becomes overwhelming and we resort to our own particular bit of the food system and focus on that. But in Tim Lang's words, it can be a policy cacophony. And we focus on our little bit, on our instrument, on the music in front of us, rather than thinking about what we're trying to achieve collectively and potentially what we can do together to make a bigger difference. In Scotland, I think we're doing a pretty good job of thinking about some of these issues. Nationally, we're at the forefront of considering what type of food system we want for the future. Other countries are beginning to think about that, but we've been having this discussion for a while. And the Good Food Nation Bill that is currently in the programme for government for the coming year is a real opportunity to think about what kind of food system do we want? How can we build health, equity and sustainability into our vision for the future? And how can we unify the policies that we have across government, from agriculture to education, from planning to health? How can we unify them so that they work together and help us achieve that vision? At the moment, sometimes there's inconsistencies, and some of the policies that we have even conflict with each other. The other possibility that the Good Food Nation brings is the possibility of enshrining the right to food in Scots law. And this would encompass not just the individual right to sufficient nutritious food, but it would also encompass our collective right to a fair and sustainable food system. Now, this is a fantastic opportunity, but it's still a bill. And over the next year, there is the opportunity to shape that bill. And I think as a public health body, we need to get behind that bill and think about how we can use that bill and how we can think about how we can achieve our public health priorities through shaping that bill into a food system that works together and helps us achieve our goals in terms of health, equity and sustainability. But I think the Good Food Nation work aligns well with the United Nations Sustainable Development Goals. You'll be familiar with these, but these recognise that synergies come from addressing these goals in tandem, and that the coordinated action on sustainability, equity and health can help us make further progress. A few of these clearly relate to food. I've circled these: zero hunger, good health and well-being, reduced inequalities, responsible consumption, sustainable cities even. But actually, when you begin to think about the issues that I touched on in terms of the broader system, and you begin to think about the breadth of implications for health across the food system, all of these are relevant. For example, if we begin to address the issues in agriculture and move towards a more sustainable approach to agriculture, we can begin to improve our water. We can reduce our water pollution, contributing to the clean water goal in number 6, and also reducing the impact on fish and contributing to goal number 14 there in terms of life below water. And if we begin to think about our local food economy and invest more in good employment within that local food economy, we can also work towards goal number 8. So all of these are integrated, and all of these will benefit from a move towards a more equitable, more healthy, more sustainable food system. And I think we can look at the public health priorities in the same way. The public health priorities offer an approach that can help us think collectively about how we address the food system, and not just the consumption part of it. I think when we first look at these priorities, we might focus in on number 6 and think, well, that's the one that relates to food. But actually, we could make progress on all of these by working across the food system and thinking about where the opportunities are to embed equity and sustainability and health across that system. So that gives you a quick run through of the context and it gives you a bit of context and rationale for the work that we're doing in Glasgow. Not my work, but a work of a whole range of people who have been enthusiastic and passionate about this work for a number of years. But this is the question that's driving our work in Glasgow. Glasgow's not unique in this at all. There are a number of other cities addressing this question, both in Scotland and in the UK and across Europe and America, through things like the Sustainable Food Cities Network, the Urban Food Policy Pact, it's the Milan Urban Food Policy Pact, and the Food Policy Council movement in the States. In Glasgow, our work really began, or certainly my involvement in the work began in 2014 when the Glasgow Centre for Population Health had a seminar, and Professor Kevin Morgan from Cardiff posed this question: how can we promote healthier cities through more sustainable food systems? As a result of that seminar, a number of people, interested people, who really thought that that was an important goal and they shared that vision, they came together to discuss how we could begin to make progress on this. These people had different interests, they had expertise in different bits of the food system, but they all had this shared goal. And that became the Food Policy Partnership, and that has continued to meet in Glasgow over the last few years. Our goals in the Glasgow Food Policy Partnership are up on the screen now, and we work together, as I say, on our different bits of the food system, but we all share these goals. It's worth saying at this point that our partnership has no statutory power, little budget, limited resources, but we're working to have a stronger voice and to influence the conversation across the different bits of the food system that we are part of. And we're looking to find where there is good work happening that we can scale up, where there are things that we can connect across policies or across sectors to build more synergy, and where we can think about new action and try and mobilise work towards that. So how are we doing that? Well, we're thinking about the whole food system. We're thinking about where the opportunities lie in that whole food system to make progress on issues that are important for public health. We're learning from others. We're part of the Sustainable Food Cities Network, and many of those, that are a number in Scotland as well as in England, some of them are a bit ahead of us, and we can learn from them what's worked. We can also share some of the challenges and some of the really tricky things, and that's been a really helpful development. We have ambition. I've mentioned our shared goals, and we have cross-sectoral leadership, and we're continuing to work to find where the champions in the different bit of the food sector in the city, and can they join us, and can they help share this conversation and help people think about how they can fit into this move towards a different type of food system in the city. We're trying to build connections, not just between the Good Food Nation work that I talked of and the great work that's happening in communities, but also between policies. Where are the synergies? For example, we have a tourist strategy in the city, and we know that tourists who come to Glasgow want to eat. And how can we develop even a bit of the local economy that takes advantage of this? It means that local people benefit through employment and a more resilient local food economy through the visits from tourists. We're trying to support and enable communities. As I said, there's fantastic work going on there. What more do they need from us in order to do their job better? And how can we learn about their approach? They often take a really positive approach, and they encompass equity, fairness and health and sustainability in their work anyway. What can we learn about what they're doing and adopt some of that in our work? And how can we build a stronger food economy? I'll talk a little bit more about this in a minute, but collectively we spend a huge amount of money on food. Can we use just a little bit of that locally and help try and get a bigger bang for that buck? Just going to talk quickly about a couple of these points. In terms of supporting and enabling communities, I've mentioned this quite a bit. As I say, we've got a very vibrant community food sector in Glasgow. When the Glasgow Food Policy Partnership was first established, the Scottish Government had a conversation with us about whether or not it would be helpful to develop a more formalised network. We felt very strongly that wasn't our place to make that decision, so we went to our community food colleagues and asked them, and they were quite keen to do that. So what we did was we said to them, well, we'll support you to do the research, and you think about what that would look like for you and how that would work for you. So a few years on, we now have a formalised community food network in the city that is established as a community interest company, and they are doing tremendous work, not just helping them to have a voice as part of some of the discussions we're having at city level, but also them coming together and doing more collaborative work. For example, the Veg Cities campaign that they've been undertaking over the past year or so is something that is related to work they're doing called Routes to Market, which is some work they're doing to try and stimulate and influence a stronger local food economy by connecting local growers with local chefs, supporting the emergence of more market gardens, working with the local authority and other partners on access to land and food growing, developing local, smaller, shorter supply chains, and also promoting people to eat more veg and more local veg. We worked with, or the network worked with local schools, and they developed these posters to advertise a campaign to increase veg consumption in the city. And there's also a chef's challenge, where local chefs from restaurants across the city are invited to take part in a kind of master chef type challenge, where they get a box of locally grown veg from a community garden, and they are to produce a menu that celebrates local veg in the city. And the idea there is to get them thinking about how they can use local veg in their menus more often. I've also talked a lot about building a stronger local economy. This is not just because of the multiplier effect, but that's an important part of that. There's good economic evidence that money that is spent locally on food, particularly if it's spent in a local food outlet on food that has a relatively short supply chain, that has a multiplier effect, that money is reinvested within the community and has multiple benefits, much more so than money that is spent in a multinational and leaves the local food economy immediately. But spending money in the local food economy also supports local businesses. It builds more local employment. It reduces food miles and carbon emissions. Builds a more resilient local food system that's more resilient to disruption and shock. And it also supports more vibrant neighbourhoods, particularly if it means we have more local shops where people can go to on a regular basis. So where next then for our work in Glasgow? Well, we want to scale it up. We want to build more of a movement towards a different kind of food system in the city, and to put equity, health and sustainability at the heart of that. We now have a Sustainable Food Cities Coordinator who's in post, and she has been a fantastic help in moving us forward towards this. We had a City Food Summit in Glasgow in May at the City Chambers, where 150 people working across the food sector came together to celebrate the fantastic range of work that is already underway, to learn from each other, but also to think about what they would want from a city food strategy. And we now have a commitment to a city strategy on food. And that city strategy will not just be a city council strategy or an NHS strategy, it will be a city strategy, and we hope that all our partners will make a commitment to supporting us towards that. We're at the early stages of developing that strategy, but we hope that it will be complete and launched in a year's time. And we hope that that will help bring cohesion and synergy and more coordinated city level action, which in turn can help support the local food development plans which are currently emerging across the city, as well as make connections to the Good Food Nation work nationally. So finally then, my key messages for you are that the current food system impacts negatively on public health and health inequalities in a range of ways, and this goes beyond dietary ill health and food insecurity. I think that more connected action on health, equity and sustainability across the broader food system can help achieve multiple public health priorities. We just need to think about food a little bit differently. There are promising developments nationally in terms of the Good Food Nation Bill and locally in communities, and I think as public health we would do better to support that more to help us move towards our vision of what we want to achieve through our food system for health, for equity and for sustainability. City or locality level strategies can help connect the national and the local developments, and also build more synergy and connection across the different sectors and policies that touch on the food system at city level. So I think that public health has an important role to play in leading and supporting and enabling change across the food system. We might just need to think about things just a little bit differently. So in conclusion then, I just want to thank the various people who've been involved in the work in Glasgow. They are dedicated, enthusiastic and bring energy and enthusiasm to this work, and they're great fun to work with. Thank you. Enjoy your lunch.